pleasure to introduce Dr. Sharon Smith, who is the Executive Director of Sanctuary Mental Health Ministries. Sharon Smith has spent much of her professional career working as an occupational therapist in acute and community mental health settings in South Africa and Vancouver. She has her Master's in Christian Studies from Regent College and her PhD in Rehabilitation Sciences from the UBC. Sharon's dissertation explored the meaning of spirituality for people living with schizophrenia and consults for mental health organizations where she facilitates mental health professionals to integrate spirituality into mental health care. Her most recent work has been with Vancouver Coastal Health and with Sanctuary Mental Health Ministries, working alongside churches to prepare people of faith to support mental health recovery within their community. So once again, it's my great pleasure to welcome and thank Dr. Sharon Smith for joining us today, and we greatly look forward to the presentation that's to follow. Sharon.
Wonderful. Thank you, Matt. I'm just setting up here, getting my webcam up and rolling. Lovely to have so many of you joining me today here. It's kind of strange being in my own home and knowing that here I am speaking to people all around. Please do type in questions as we go, and I will pause at certain moments and then reflect on those questions as time permits. So we're going to be considering spirituality, culture, and worldviews, and specifically looking at the context of mental health recovery. And my background brings me to this topic as a mental health professional, but also as a family member, as somebody who has walked with a parent and with a late spouse through their journey of mental health recovery. And so just so that you know, I am informed from various perspectives, from an academic, from a professional, and then also from a personal one. So when we come to the area of spirituality, it is a professional and a personal construct. And so you'll see in the 4 objectives that we've laid out for this session, it is also incorporating some personal reflection for yourselves, because spirituality does touch on the professional and the personal. So here are the 4 objectives. Let me read them out just so that we're all clear and on the same page. And what I'm going to do as I work through the material is that pretty much at the end of each objective, I will pause, and then there will be time for me to scroll through and consider some of the questions that have come up. So firstly, I'd like to give each of us an opportunity to grow our understanding about the complexities of spirituality. That is the meaning and the language we use to talk about it. And that is helping all of us take a bit of a step beyond the basic definition for practice. Secondly, as I mentioned earlier, that we could all have an opportunity in this next hour and a half to explore our own worldview and how this relates to mental health recovery. The recoveries that each of us go through in our lives, and the recoveries of those that we support, perhaps professionally, and then also in our personal lives. Thirdly, I want us to explore the relationship between spirituality and recovery. And then lastly, to provide an open framework that we can use for spiritual conversations within the mental health practice settings that we work in, that takes both culture and worldview into account. So let's get right into it then. So as I acknowledged, spirituality is a personal and professional construct. I think it is important for us to reflect on our own. Because when we reflect on our personal spirituality, we reflect on our narrative, we reflect on where we come from, our beliefs, our stories, our biases, our locations. It is only then when we are comfortable with our own that we can make space for the other who would possibly be different to us. And I would guarantee would have different assumptions to us in this area. And so what I want to start with, I think it's only fair that you know where I come from, where my spirituality has developed from. And so this accent is not from around these parts. I am from South Africa, and there's a little map there, specifically from Johannesburg. And my narrative, my beginnings of my conversation around spirituality, the language that I inherited from my family was that of a conservative Baptist tradition in Christianity. And that's the beginnings. Spirituality, like culture, is emergent. And so over time, as I then got involved in mental health practice, as I then immigrated to Vancouver, Canada, my spirituality, the language that I incorporated into how I talk about spirituality, has changed and morphed depending on what I've been exposed to. And so as I entered this world of psychiatry, I worked in an acute psychiatric setting in Johannesburg at the close of apartheid. And so this was the beginnings of the multicultural birth of South Africa. I found myself working in a long neurobiological setting where there was a dominance of constructs of the mind and the body, and spiritual ideas were subsumed under those concepts. And what I found it did for me personally was that I became frustrated at this stage, a pre-reflective therapist, not understanding where that frustration was coming from. But there was part of me that was unable to express myself in that clinical role because my spiritual understandings were not allowed to be voiced in that area. And so there became this conflict between what it meant to be human. I understood a human being to be made up of a body, a mind, and a spirit in community. And I was working in a context where the body and the mind were dominant. I also noticed that there was dissonance happening for some of the clients that I was working with as well. Many of my clients came from a Zulu background, and their culture meant that they had a mystical worldview. And we'll get into understandings of worldview in just a moment, but I'm just giving you a picture of why I developed a strong interest in spirituality, particularly in the area of mental health recovery. And so for my clients, their dominant understanding of interpersonal experience came from an understanding of ancestors, those that could not be seen, that had passed away, that were still having an impact on their lives. And so it was this ancestral spiritual realm that was a dominant understanding for what psychiatry was calling a mental health experience, a mental health issue. And so there was, again, for our clients, this dissonance, these worlds colliding. And so as a pre-reflective therapist, I found my personal world in conflict with the professional understandings of that particular psychiatric context. And my dissonance was mirroring the dissonance of some of my clients. So it was really important to pay attention to. And that is why I'm of the opinion that for each of us who work in this area, we need to consider our own personal perspectives, because it will be in service not just for our practice, but also for the clients who we're working with. Sally Densher, and just my apologies for the size of this slide. This is from an article called Reflections on the Confluence of the Personal and Professional. It is from the Australian Occupational Therapy Journal, 2002. And here Sally Densher speaks about an underground practice where those of us that come into practice that are pre-reflective are operating with some assumptions that are influencing and impacting the way we practice, perhaps without us knowing. And I would say that until we, if you follow that arrow round to the left, become aware of our worldviews through what she does, she works with autobiographic reflection, writing and reflecting on certain questions. I believe some of that can be done verbally as well, depending on the kind of processes we are, whether we're verbal processes or writing, perhaps internal written would be easier for us. That as we reflect on our worldviews, we can then understand how that manifests itself in our practice. And then as we articulate that and lay bare that underground thinking, that then leads to our reasoning. Now you'll see it's occupational reasoning because this is from occupational practice. But I would just broaden that to say that that would have implication on our clinical reasoning, whichever practice setting we might be coming from. So what I want to do now is just to pause for each of you to take a moment of self-reflection. Obviously, this is landing at a moment where you're already in process and also will continue in processing your own thoughts around spirituality. But here are just 3 questions. And again, I just want to acknowledge that this is important for us because evidence shows us that mental health care providers are less likely to acknowledge their spiritual beliefs than the general population. So it's really important for us, I believe, to be actively reflecting and then perhaps talking it out to somebody as we begin or continue this process. So as a child or teenager, what was your experience with spirituality and or religion? What beliefs have you acquired or were you exposed to later from the wider community? Ponder quietly. And then lastly, is spirituality a helpful concept for you personally? It may be, it may not be, and both are okay. I realize that these questions will require further reflection, and so these notes will be available for you, and you continue to do that as you continue to reflect and grow in your own practice of engaging with the spirituality of your clients. Let's move into the next section here, which is considering the difficulty with defining spirituality. When I was working on my PhD, I remember a number of my colleagues saying, Sharon, you are trying to nail Jello to a wall. And it really did feel like that, studying at UBC, where many of my colleagues were working on quantitative, measured constructs. I was trying to understand spirituality. And what we find is that spirituality can be defined in 2 different ways. Firstly, we can define it substantively. And what that simply means is we can try to offer an explanation of the substance of spirituality, what it actually is. Now, that's easier done in homogeneous cultures. So if I was working in Northern Africa, for example, amongst one group of people who might practice a similar spirituality that is bounded or framed within their culture, it would be easier for us to together agree on a substantive definition of spirituality, what it is. We might define that there is a higher power. We might define that there's certain practices that we do in order to connect with that higher power and to connect with each other. We might define that there are certain beliefs about human beings in relation to each other, in the community. And we might define what the community does together to remain cohesive, certain behaviors that are allowed, certain behaviors that are not allowed. So that would be some substantive definitions of spirituality. Now, like many of you, I have practiced in British Columbia, and particularly in Vancouver, which is a pluralist, multicultural context. By pluralistic, I mean that each of us hold different values. We can't make assumptions that my values, my beliefs are the same as yours. And so I would find it very difficult to come up with a substantive definition of spirituality. In other words, what it is that we would all agree on. Rather, I would say that in this kind of context, in a multicultural pluralist context, it is more helpful for us to settle on what I call a functional definition. And that is how spirituality functions for me and for you. How it functions. It's the next step down. It's not saying this is what it is. It's saying this is what it does. And dialogue is a lot more helpful on that level. Okay. So what is spirituality? Easier to come up with a functional understanding that we can all relate to. And I'm going to slowly unfold a framework, a functional framework that we will discuss toward the end of the lecture that can be used by all of us in our various practice contexts. The diversity of language we found within the literature goes between two areas. The first, it would be trying to find this universal language. And what we find is that we tend to go for the lowest common denominator, something that we can all understand. So it would be something like spirituality is about meaning, or spirituality is about hope. And while these are helpful, they're helpful as entry points because each of us have a particular language, a personalized language that is meaningful for us, but that might be difficult for us to access. So let me give you an example there. While our universal language might point to spirituality giving hope to each of us, my particular language might name what the hopeful aspects are. So, for example, in my particular worldview, I might believe that suffering is transformative. And so, as I go through a mental health recovery journey, I find my hope common to all, but I find my particular that through this experience, I am going to be transformed. So it's important for us to realize that there is some universal language that we can use, but that opens the door for some particular personalized language that we all may have. And so when we converse about the function of spirituality, we need to bear in mind that some of us might be using this universal understanding as a way to access the particular that we each hold. Let me give you an example in the next slide, and this comes from the Canadian Association of Occupational Therapy. And most of our different associations have adopted a very generic or universal summative definition that is a bit of a catch-all, trying to provide a framing that we can then hopefully access our particular understanding from. So here is the one that the Canadian Association of Occupational Therapy has adopted. That spirituality is a pervasive life force. It is a manifestation of a higher self. It is a source of will and self-determination. It is a sense of meaning, purpose, and connectedness that people experience in the context of their environment. Now, I don't know about you, but for me, there are some universal aspects in that definition that I connect with. I connect with higher self. I connect with meaning, purpose, and connectedness. But I want to say yes, but, or yes, and. And what that means is there are some aspects in this definition that are referring to the universal that access my particular, and there are some that are actually particular that are not congruent with my particular. And so understanding language when we talk about spirituality in our context is key. That we're open to listening for difference, and we're open to listening for commonality. It's not always easy for us, because the reason why we've adopted our personal spirituality is because we believe they're right. And so it brings a value conflict, a potential value conflict, which is why reflection for us on ourselves is important, to be comfortable with our own, that we can open up to the other. Here's another area, or a particular area, where there has been conflict and confusion when we think about spirituality. Does it include religion, or doesn't it? To point us to a study, and there's further work that's being done. In fact, Zimbauer and Hill are two authors that I would really highly recommend, and they're specifically doing studies on the language that we use to describe our spirituality. And so the first would be, if we look at the far left, there are those of us that see spirituality and religion as somewhat overlapping, somewhat related, but not fully overlapping. So there's room for me to say, for example, there are aspects of my spirituality that are informed by my religion, and by religion, what I'm meaning here is a system of institutionalized beliefs, values, and practices. Let me say that again. Religion here is a system of institutionalized beliefs, values, and practices. And so for some of us, we have been part of that system. And so the system's ideas have influenced our personal ideas. And so there's some overlapping. For others of us, we would fall into this middle category, where we are completely embedded in a system. And so our personal understanding of spirituality is completely informed by that religious system. And then there are others of us who would fall on the far right, where we would say that our religious system maybe at some time in our lives influenced our spirituality, but now we have separated out from that and have formed our own spirituality distinct from that religious system. Or we may not have been part of a religious system. And our spiritual language, our way of talking about spirituality, has been informed by our context, by the culture of my family, by the philosophies that I have read and been exposed to, by the media that I have been exposed to, books, film, television. And so these are various ways where our language comes to express the spirituality that we now personally own. Now, when we bring this into a practice context, we need to understand that yes, we're going to have some generic or universal ways that as practitioners we can draw from and agree on higher level pieces. But as we mentioned earlier, that is going to unlock the particular. And the particular is going to come from our particular, I don't want to use the word worldview yet because we're going to get into that in a moment, but our particular systems that we have been exposed to. And over life, we may move. We may move from the center picture to a spirituality that has separated a little bit out and then maybe separated completely out. Or we may move from where the two are distinct to the two coming together, depending on the different systems we're in. Now I see that there aren't any questions as yet typed up there. I'm going to pause right now. If there's anyone at this point that has a question regarding language of spirituality, I'll give a moment now for you just to type that up, and then I can respond to that. I'm just going to wait a moment or two to see if anything's coming. I see Giovanna is typing. Perhaps it's a long question, so we're just waiting for that to pop up there. So we realize that we are talking generalities. Yes, we are, and right now we're now going to move in. I just wanted to frame the topic for us because I think sometimes we dive into spirituality without really understanding what we are meaning when we talk about it. And so the next part of our topic is to specifically look at what it means to bring spirituality and mental health recovery together. And then you're asking, do we get into the problem of the time where the worldview becomes a problem for the individual? Yes, we're going to look at the complexities of where a mental health recovery in particular may challenge somebody's worldview and what happens. So we're going to touch on that in just a moment. Thank you for that clarification, just in terms of where we're moving with the list. Anyone else have a question? I think I should move on. I need to be conscious of time as we move further into the material. I think there might be further questions. So if spirituality has such a difficulty, I guess, a difficult history of defining it and of relating around it together, why bring it into mental health recovery? Why do that? Well, I think we can know from our practices, but if we look at the literature specifically, we can see that consumers are telling us that spiritual practices are resources for coping. I worked with a consumer commission at Vancouver Coastal Health. And when we looked at spiritual practices, I remember one of the members saying to me, I visit my clinician once a week, but spirituality is there for me 24/7. I remember comments around how rituals provided the needed structure for a day for somebody. And in that structure, there was uh, a resource to manage emotion, a resource to manage the confusion around how do I time the different activities of daily living that I have to do within a given day. So spiritual practices are a resource for coping, particularly during the recovery period. Secondly, literature is showing us that spiritual experience was shown to be life enhancing. And for those of us that have climbed into the addiction literature, we can also see that turning points, when somebody's at that turning point of wanting to go on through a recovery process from an addiction, we see that 70% of the time, those turning points are actually spiritual in nature, a mystical experience that then moves somebody toward recovery. I would point you to Jackson and Fulford's work. What they did was analyze stories that were sent in, this is work that was done in the UK, into the Alistair Hardy Institute, where they examined stories of spiritual experiences. Now, these were sent from anybody, anybody in the population. And they randomly selected some of these stories and connected with those individuals to find out whether those individuals indeed had a psychiatric history or not, just to try and see where spiritual experience was embedded into different experiences holistically in somebody's life. And what they found is that someone would call it a spiritual experience if they looked back on that experience retrospectively and found out that it was actually a life enhancing experience. In other words, it moved life forward in a good direction. And this was seen as different from perhaps a psychotic experience that had some spiritual components in that caused somebody to have a distressful experience, a distressing experience, which then needed to go through a recovery period. And so, very interesting that spiritual experiences are seen to be life enhancing, very hopeful for mental health. Thirdly, spiritual beliefs can be a meaningful framework to understand experience. And again, I would point you to the work of Ellen Corrin, who works within, particularly in the context of India. And she has looked at the life journey of people with schizophrenia living in India and how, from a Hindu perspective, they understand different experiences that, from a Western perspective, we would put a schizophrenic label to it. So let me give you an example. One of the diagnostic criteria, I guess, and symptoms of schizophrenia is social withdrawal. Now, in Hindu belief system, there is this understanding of renunciation, where I withdraw in order to work through something. And it is seen as a positive element. And so she analyzed, what does it look like for someone who's living with a condition that the West would call, or that Western medicine would call, schizophrenia, and that someone in this particular context might frame as renunciation. And Corin, and I would say my own research also, would see the value in what we call multi-framing, where someone is able to say, yes, this is withdrawal, social withdrawal, that is part of a condition called schizophrenia, and I need to take medication for this, and I need to work through the different stages in all the areas of social recovery, in all the areas of psychological recovery. But I can also name this as renunciation, and I am not as stigmatized in my community because I can multi-frame this particular experience from a spiritual lens and from a body, mind, and social lens as well. So I would call that multi-framing an experience can be quite helpful. I know that it's helpful in my own recovery. I've gone through a significant grief experience. And when I understand my grieving experience as a time of letting go, but also a time of depression like experiences, I then can hold those two things together and understand the positive elements of the recovery process. And I can also understand what I need to do in order to move through. So I point you to that third point there, the spiritual beliefs that are meaningful frameworks to understand experience, because in our clinical practices, often we're inclined to move someone toward the mental health recovery language away from perhaps a spiritual language or a spiritual word so that we can move them on the path toward recovery. Yes, I would say definitely, but I would encourage us to play with multi-framing. Could it be that it is this and this at the same time? Because as holistic beings, body, mind, spirit, in community, there may be different explanations for the same experience, and they may coexist. And then lastly, spirituality is seen to be helpful in mental health recovery because spiritual communities may provide places for belonging and social integration. Now, I say may provide because in the work that I do with Sanctuary Mental Health Ministries, we have noticed that there are many conservative communities in particular where faith can be seen as all encompassing and to the exclusion of mental wellness. And so it is important that we work with communities to bring some, again, a holistic understanding, some balance, so that mental well-being and spiritual well-being can coexist. So those are 4 areas where spirituality is seen to be helpful in mental health recovery. But it is complex. It is not easy, right? As we've alluded to. And so our spiritual beliefs can be meaningful, but perhaps they can be incompatible with something like medication. I'm working with a community at the moment where it is seen to be disobedient to their higher power to take medication. And so if we think about that, and we're trying to work with someone to understand their body, their mind, their spirit in community, their community and their spiritual understanding may then be at odds with what might be helpful for their body and their mind. And then the second point there in research from Miller and McCormack, where we see that spiritual practices can be a resource, as we mentioned earlier, like certain rituals, but they can also exacerbate internal conflict. And what I mean here is that there might be a crisis, like God might be punishing me And the illness is experienced as a punishment from the divine. And so it creates further conflict internally. There might also be some areas of conflict around spiritual practices, such as fasting. I've worked with a number of clients where they are in recovery from an eating disorder and they're going through Ramadan, for example, and the period of fasting is in direct conflict with this stage of recovery. So the fasting schedule is a fast during the day and a feast at sunset. And here we are trying to assist somebody to get into a regular eating pattern. And I have found it encouraging when I think about the complexities of it, instead of to present only the mental, social, and body recovery that we are advocating for, to also include conversation around the spiritual. And we have had success in speaking with imams and speaking with family members as ways to help somebody, particularly going through a recovery from an eating disorder, to drink some kind of protein drink during the day, and then to put aside the food that they would eat during the evening. So it's not this feast and fast rhythm that's being set up. And so as we enter the complexity, we can be more helpful than if we simply stand back and perhaps not enter the conversation around spirituality. And I'm going to give you some ideas as we enter toward the end of the time together on how we can enter that conversation. When we look at the Diagnostic Statistical Manual, and we've now moved on to DSM-5, we'll see a development where initially spiritual and religious issues were subsumed under psychopathology. So because somebody is experiencing depression, they're experiencing a spiritual condition, or because somebody has a condition such as schizophrenia and they're experiencing religious delights, and to date have worked very hard to keep things separate. So in the early DSM-4, we were able to separate out clinical conditions and spiritual and religious issues. And we were able to see that spiritual and religious issues were also causing biopsychosocial issues, and biopsychosocial issues could then cause spiritual issues. And so there was a relationship between the two, and one was not subsumed under the other. I see someone's having a problem with freezing. Matthew, I don't know if you want to just comment on that in typing. I'm going to continue with the material. So what Lukoff, Liu, and Turner attempted to do for the DSM-5 is to add differential diagnoses to diagnoses like depression, where existential distress could be seen as a differential for some of the Axis 1 diagnoses. It remains as a V code and not included in the primary page in the DSM-5. But it's important to note that in our clinical context, particularly where there is a strong neurobiological focus, that there is this V code which helps us to see spiritual conditions potentially as primary. And this is really important when we consider our clients' world views. So let's move into that, looking at how worldview operates and how it can influence the way we understand the condition that we might be living with or our client might be living with. So just very broadly then, a worldview is a framework or a paradigm. It is an individual set of philosophies, beliefs, and values. And it is informed by a cultural understanding as well as a spiritual understanding. So I just want to be clear that culture and religion are not the same thing, and that culture and spirituality are not the same thing. They mutually inform each other because they are emerging. Both emerge over time as we are exposed to different cultures, philosophies, as we engage in different conversations, as we might attend different religious systems. Our worldview, made up of our spirituality, culture, and potentially, if we're exposed to that system, our religious system, grows over time. So it's kind of like these pair of glasses that we get to put on, right? And even though as we age, our eyesight gets less and we have to put different glasses on to actually enhance that, I would say with worldview, it might be the opposite. That as we're exposed and aware of more, we then put on different glasses to then, again, focus on all that is around us. And so our worldview changes and morphs over time. So just some other definitions of worldview. Before I consider these three worldview questions, I want to just respond to Nona's question there. Would early obsessive compulsive disorder be an example of this? Now, Nona, when you were talking about an example, I'm thinking about an example going back of the complications of spiritual practices and perhaps obsessive compulsive disorder. I'm going to speak to that if you could clarify as I talk, because what I have found in some of those early symptoms of obsessive compulsive disorder, there is often heightened spiritual practices. And so I've seen clients wear away the skin on their knees, praying, trying to relieve themselves of the symptoms that they are beginning to experience. And so that practice becomes conflicted, right, as a way of trying to recover through primarily a spiritual focus. And they might not be seeing that there is a body, mind, and social issue that might be going on. So if you could just clarify if I am going on the right track of answering your question here. I see that Nona is typing and it might be taking a while for it to appear on my screen. I think maybe you're also referring to some of the V code in the DSM there, where we might have distressing experiences where there's persistent questioning, right, of things that we might believe, or distressing experiences around constantly reviewing some of the values that we might have. And it might be difficult, as Nona says, to understand where the spiritual part ends and the illness begins. I would say that in my perspective, I wouldn't draw a very clear line there. I would say that both those things are happening in parallel. And so a person is having a spiritual experience and they're having a mental health issue at the same time. They are influencing each other. And it is not clear. It is actually gray. And the person may choose to have a dominant spiritual lens Whereas the mental health professional might choose to have the dominant illness lens, and that's where you have the conflict happening. If we can clarify together what it might mean for us as a human being to understand what it means to be a person and go through experiences, we could actually form a working relationship where we consider both the spiritual and the mental. And I'm going to give you an example of that in just a moment. So, three important worldview questions that come up for us in the realm of psychosocial rehabilitation would be first, what does it mean to be a human being? So, our client may say, oh, it is a person who has this really strong spiritual component, and the spiritual dominates, and the spiritual is actually in the body and the mind, but the spiritual is the dominating piece. Some may say, oh, we're just a body and a mind, and the spiritual does not have a part to play. So that's a really important question to ask our clients. How are you understanding this right now? Because then we can get to understand what are they seeing as the dominant framing for understanding what they're going through. The second question there is, what is real for me? Is it primarily the things that I can touch and smell, the things that I can observe under a microscope, the things that when I go for a CT scan, the doctor pulls out and I get to see it? Is that the dominant primary reality for me? Or is it beyond that? And I think sometimes that's where our conflict comes in. And thirdly, why do human beings suffer? It's a question that so many of our clients are asking. Why am I going through this? Why me? And what I have found is that our practice contexts are answering the question, how can I recover? But spiritual contexts are answering the question, why? And both questions are important for somebody's recovery. To grapple with the why, to come up with constructs like suffering can be transformative. Suffering is part of what it means to be a human being. Suffering helps me relate to individuals who live in a third world context who don't have food. Suffering touches my life so that I can help others. Those are conversations that tend to happen in spiritual contexts and which I think are necessary for someone's meaning making through their recovery process. Our clinical contexts tend to focus on how can I journey through recovery. And I think it's so helpful if we affirm the why question as part of the recovery question. And I'm going to give you that framework as we come to a close to actually draw some of those questions together. Susan's asking that, or just making a comment that this sounds like advanced care plans are a tool for individuals to clarify where their personal values are regarding this gray area. Yes. And I would say not only for our clients, but in our professional growth as well, that we are exploring this gray area for ourselves. Because if we make space for it for ourselves, we can make space for it for our clients, and it doesn't seem as scary. Now, when I say this is a gray area, for so many, it kind of needs to remain that it's an individual's process of meaning making that begins to provide clarity over time individually. And so it is a journey through that area on a personal basis. I don't know if we can create complete clarity between spirituality and mental health recovery generically, because we'd be doing it at that universal level. And I don't know if that would be helpful at the particular level. I'll leave you with that thought, because I think the spiritual journey, as we look back over particular traditional practices that span history, going back years and years, the journey of spirituality is one of gradual clarification. So it's not helpful for us to completely get it black and white, even though that's what we would like to do in clinical practice. Thank you, Susan Boyce, for your clarification. So just in diagrammatic form here, you'd notice that I've been talking about when there's conflict around different ways of seeing. So I want you to imagine that the box on the left is perhaps the client, and the box on the right is perhaps the therapist that they're sitting with in the room. The box on the left is a client who has a very strong understanding that every human being is made up of a body, a mind, and a spiritual component. And because of that, their influences, the things that cause their experiences, come not only from within this world, or within this, but also from outside, which is why there's a dashed line. And so this individual might be using language like, there are evil spirits, there are ancestors, there is a higher power who can heal me. So there are influences on my human system, my inner experience, this experience of a mental health issue, that are from outside of the realm that we can see, touch, experiment with, explore. Okay? So that person may be talking in some of that kind of particular language. The conflict may come when the professional may only understand life from a humanist perspective. Absolutely okay. It is one valid way of understanding human experience, where a human being is a body and a mind, where there is not a spiritual component, and exploring the universe through our scientific means and through our senses are the ways that we understand the world, and there are no external influences. So you can understand what happens here. We're talking about different realms. And so what's helpful for us is to reflect on our own understanding that this is not the only way of seeing the world. It is one way, and that our client may be coming from a different way. And if we're able to hold these two pictures in our mind, I find this visual can be quite helpful for us, even when we're sitting there. And I sometimes, on a piece of paper, draw these circles and say, right, we're going to talk about body, mind, and spirit here, because I'm listening to you and I hear that you're talking about some spiritual language. Can you be little, is this how you see things? And what I try and do is help with the client to see that they need to draw on resources that assist with the body, the mind, and the spirit without negating each one. Now, it's not a perfect solution, because for some, that spiritual area might overtake the body and mind. And at this moment in time, they may not want to work with their body and work with their mind and or in their social context. And that's part of their process. We need to let them go through, as we know in recovery literature, we need to allow somebody through the stages of change to understand that they may need to dip into other resources to help them in their recovery. But that's going to give them time as you challenge their worldview, and may I add, as they're probably challenging yours, that both worldviews are given a chance and are given time to expand. And if we can acknowledge that there's going to be time for that to happen, then we can build that relationship and help somebody build their resource toolkit for their recovery over time. Let me give you an example here, a little vignette from a Muslim community. And this is from an excellent resource that I want to highlight for you. Just getting the exact wording of this book. It is called Spirituality, Values, and Mental Health. And the author is Coyle, Gilbert, and Nicholas. Perhaps I will give this resource list to Matthew to actually distribute afterwards, just so that I know how difficult it is to be listening and taking some of these names in. But in this particular resource, it is written as a collaborative effort from faith leaders, spiritual leaders who are not part of a religious tradition, written by people who are in recovery, and written by mental health professionals and family members. So it's a collaborative, edited volume. And this example actually comes out of that, where they looked at the Muslim community and they saw that one of the explanatory models that people were holding for mental health, a mental illness or mental health issue, was what they would call jinn. And I'm terribly sorry about my pronunciation if anybody is from this particular, has this particular worldview, which are spirits that are unseen and dwell on earth and can possess people. And one way to combat those spirits would be through black magic or jadoo. And in the spiritual community, the treatment would be that an imam would perform an exorcism. They would pray some protective prayers over that individual, over their family, extended family, and over their house. And there would be an exercise of drinking holy water called pani pani. And in doing that, that person is provided, care is provided by that community. Now, I want us to imagine engaging with this as a mental health provider. And I would think to myself, oh my gosh, what do I do here? I would draw my 3 circles with that family and I would say, I want to support you, your understanding of spirit. I want you to remain part of this care that's provided in the Muslim community. But I'm also seeing some things that are happening in this person's, or if I'm speaking to the family, in your mind, the way you're thinking. I'm also seeing some things that might be happening in your body. And I wonder if together we can work on your body, mind, and spirit toward your full recovery. And I find that an approach like that, a collaborative approach, has a chance of working. Rather than the individual and their family member being in your office, nodding to everything you're saying, and then not following it when they leave because their dominant worldview hasn't been engaged. So I want to just pause a moment here as we reflect together. I encourage you to do some of your own self-reflection. And here are 4 questions that you can ask yourself, but that are also helpful to ask clients. What is your personal explanation for the symptoms associated with what I'm calling here a mental illness, right? Because they may not term it that way. Is this explanation the same, or is it different than your spiritual or religious community if you identify? And that might be a point of tension for the person, as their worldview might be changing through this mental health issue and the experience of recovery, and it might be growing distant from the dominant worldview of their spiritual community and perhaps their family as well. Third, who do you feel should be involved in the healing process? And fourth, what spiritual beliefs and practices do you believe could help alleviate these symptoms that you're experiencing? And I'm not quite sure how to pronounce your name, Palm. I'm going to call you Palm, if that's okay. With my good old South African accent and not being exposed to someone who has that name before, you're asking, does body, mind, and spirit all work together? In some worldviews, in others it doesn't. And so that's where we need to understand that. That's why these questions can be helpful. Let me give you an example of where they may not work together. In a very strongly Pentecostal Christian tradition, there is a belief that the spiritual understanding, somebody's spiritual belief, their spiritual experiences dominate the body and the mind. Not in all Pentecostal traditions, but in some. And so in these traditions, if something is happening in the body, the spiritual is primarily seen to be distressed. And so what would need to happen was a primary intervention in the realm of the spiritual. Sometimes that is to do with evil spirits, quite similar actually to this Muslim vignette that I shared earlier, except the evil spirits would be from Satan or from the devil. Or somebody is having a block with the Holy Spirit entering into that person's world, in their life, their heart or their soul, as that particular tradition might describe it, and the body is reacting to that. Okay? Or, here's an example from that same tradition, someone might be having an overwhelmingly positive experience, drowned in the Holy Spirit, filled with the Holy Spirit to overflowing, such that that person falls to the floor and convulses and starts howling like a dog. Those experiences happen within the Pentecostal tradition, where there's a dominance of the spirit and sometimes an exclusion of understanding what could be going on with the body. So I want to say that the way that the body, mind, and spirit may work together or not work together may be understood differently. And it's a point of clarity that we may have to gain from the particular client that we're working with. I hope that gives some light to that question. So now in the last 15 minutes together, I want to introduce this framework that I've been alluding to throughout our morning together. I want to say, and I want to honor the work of Edward Kander, who comes from a social work perspective, who really was a pioneer in healthcare in trying to separate out the different elements of spirituality. Because I think when we throw the word spirituality around, what we're doing is we've got some assumptions that we're doing. We're saying the way I'm using this language is the way you're using this language. So let's just use the word spirituality and agree. But I hope you've seen that that's not the case because of the different worldviews we have, the different way our language was formed over time. And so it's helpful, I believe, to make some separations. And what Kander did for us was separate out 6 different dimensions of spirituality. He says that there are spiritual perspectives, there are spiritual drives, there are spiritual experiences, there are spiritual functions, there is spiritual development, and there are spiritual expressions. So he developed this for the social work profession, and this model has developed over time. I just wanted to honor his earlier work because that's what has influenced me and the work that I have done. And so as I moved into working on a framework, and this work was done partially in my dissertation work at UBC, and I want to honor the work of Dr. Melinda Suto, who was my supervisor. But it was also completed, I would say, with the framework I'm going to present to you was completed by a working group at Vancouver Coastal Health. And that work group came from a variety of cultures, a variety of perspectives on spirituality. We had some folk in the group who were self-identified agnostic, atheist, humanist. We had First Nations folks also as part of that collaboration. There were people with lived experience of mental illness. There were family members, and there were mental health professionals from various levels in the organization. So I want you to know that this has been collaborative. And I see Giovanna's asking, were there Wiccan? Yes, we had Wiccan consultation as well. And so the implications for mental health practice that we considered as we walked into putting this framework together was that we wanted to be very cautious of the language we were using. As you see, that's important. Secondly, we wanted to include and be mindful of worldview concepts. That was important to us. The third thing is that we wanted to consider individual and collective considerations. So we were thinking about what would it mean for this individual to then be part of their spiritual community as well as being an individual. So we wanted to bring those pieces together. And lastly, and sorry, I'm afraid with the conversion from my Mac to this platform, that little part is being cut off. But further, we wanted to break spirituality into named parts that would be useful for conversation. And so we settled on 5 different areas that we thought were really important when it came to mental health recovery. We wanted to include religion, but we didn't want to make it synonymous with spirituality. So we're using the language which is now commonplace in the literature, spiritual and or religious. And it's usually shortened to SP-R. Okay, SP-R, spiritual and or religious. And we were looking at practices, we were looking at beliefs and meaning, we were looking at agency, and what we mean here is giving each person the freedom to choose the language that would best suit them without our questions being confining into one way of thinking. The fourth area there was acknowledging that there are spiritual and or religious experiences that are separate to the mental illness experience. They may be influencing each other, but we want to acknowledge that there is this entity. And the fifth thing is that people were participating in spiritual and or religious communities. And so as we brought these concepts together, we settled on a functional framework. And I, again, just remind you of that is different from a substantive definition. So what we're doing here is we're not saying spirituality is. We're saying spirituality is useful for, or spirituality does, right? Giving room for the function of spirituality. And so we settled on 4 areas for a functional framework. We settled on meaning making, that our spiritual values and beliefs impact the way we make meaning of the experience. And that goes back to that question, why me? Why am I suffering with this mental health issue? making sense of that. The second area is to acknowledge that your spiritual experiences that have an impact, like that turning point literature that I referred to around addictions. There's a moment where I realize I want to go on a recovery journey. It's a spiritual experience. And it functions in a certain way. It can be life enhancing. It can give hope. The third area was spiritual activities. These are things that we do to nurture our spirituality. They're active. And I'll show you on the framework some examples. And the last one is community engagement. That we engage with groups of people in a collective who understand spirituality in a certain way. Okay, so let's have a look now at the framework in our last few minutes together. Now, I realize this is small, and I do want to say that there is a link, and Matthew is going to provide you with that. That's actually on the website. So there's the link if you want to go to it. And this is our final slide. And so if you go to that link now, you're not missing out on anything. So this poster is framed as spirituality for wellness and recovery. And I want us to bear in mind that this spirituality is complex when it comes to wellness and recovery. So what this framework does is it gives us questions to explore with an individual the complexity of their spirituality in the context of their recovery. I also want to point out that it is framed by a comment at the bottom, which says exploring spirituality, keep it safe, have an open mind, create listening space. And that was important for us for the sense of agency, that each person we work with is able to use the language of their choice. Okay, and feel free to do that. So in the green, you can see the 4 different functional categories that I outlined earlier: meaning making, spiritual experience, spiritual activities, and community engagement. The black questions underneath those green headings are questions that only use universal language. Now, it's universal language as agreed on by the collaborative and the collaboration that we worked with in VCH and beyond, and those we consulted with. And each person and each collective who came from these various cultural and spiritual backgrounds highlighted words that either triggered them a certain way or moved them down a path that they were not comfortable with. And so we reworked these questions such that the word religion is not used, the word spiritual is not used, and the word faith is not used. And those 3 are often used in spiritual assessment tools or, spiritual tools that we get given in the literature. But we found within our pluralistic multicultural context, those 3 words were triggering for people. And so instead we came up with questions that were generic and universal, but that could open up the particular. And so let me give you some examples, and you can read these on the framework, which this became a poster that was then put up in different clinical settings to make it safe for people to begin the conversation. So if I use the word poster and framework interchangeably, that's where it's coming from. So if you look under meaning making, how do you connect to the bigger picture? What ideas help you find hope? What makes life meaningful or significant for you? Now, in that grade, sort of fan-shaped object that flows out of that beautiful primary colored medicine wheel in the middle, you'll see that these are the things people might draw from. So those are some examples of the particular. So, my religious beliefs give meaning. Oh, tell me more about your religious beliefs. So now that your client has used a particular word, I can follow them down that rabbit trail instead of me assuming that they're going to use a particular word. I open up with the generic question and I follow their language down the trail, following what is comfortable for my client. And that creates safety. The same would be a client who's perhaps describing a vision that they have. And you ask, wow, how do you make sense of that unusual experience? And the person may say, I'm having a Kundalini awakening. And that already has situated you in a tradition. Well, it's a tradition that may be associated with Hinduism, maybe not. It might be that they've learned that from yoga class, but that they don't partake of the Hindu beliefs that accompany that yoga practice, or it may. And so you've got some clarifying to do. And so you begin to ask them more and more questions using the language that they provide for you to understand how that spiritual experience functions for them. Is it scary? Is it life enhancing? Is it in fact a turning point for them? And if it is, I would imagine it's going to provide them with much hope for their recovery process. And just as we finish off, I'll give you one example from the spiritual activities. How do you connect to your source of strength? Oh, I go for walks in nature. Someone might say that exact same thing but use different language. I go for walks in creation. Do you notice the difference? If I say creation, I might be referring to that I think nature is created by a being. And so when I'm in creation, I might be connecting to a higher power. Someone who says, I go for walks in nature, might not be having that same experience. So we listen for the nuances in the language once we've asked. And then lastly, the community engagement. Do you share activities with others that provide comfort for you? Do you draw support from others? And the last question, both in the activities and the community engagement sections, are looking at whether the things that people are doing around their spirituality are supporting their recovery or if they're challenged. And that opens up that conversation for them, that they can begin to explore maybe their worldview is changing, maybe not. Well, that's the material that I had to present, and I see that it's 1 minute to 12. I haven't seen any more questions up there. I see someone is typing. Perhaps I could take one or two more questions. Matthew, I'm not sure how we move from here, whether we need to cut off at 12 or if there are a few more questions that I can take till about 5 after 12.
No, if we have a couple questions, we can definitely take them. That's no problem.
So I'm comfortable to field a few questions between now and 5 past 12, and that being my final cutoff for the time together. Thank you so much for these wonderful comments that I'm getting around this framework. I certainly can't take all the credit for it. I was the facilitator of the process. I do need to pay special tribute to those who shared their lived experience in a very interesting milieu, right, of their spiritual beliefs, experiences, and their experiences of their mental health journey, recovery journey. And through that sharing, we were able to put this framework together. And it's not perfect. One of the things as well is it is peer-reviewed and published, and that peer-reviewed article is also available at the Psych Rehab online there as well, and I think Matthew can give us the link to that. So my hope is that this time together has really given us a little taste. honestly, I could talk about this topic for weeks, let alone 90 minutes. But I wanted to unpack the word so that we could see how language is nuanced, so that we could see why using a framework like this could be helpful. And I really would invite you to try and pilot it in your context. There hasn't been to date any research done on what it's like to use this framework. And so I really would invite you to use that and to see what I think it could be really helpful in our particular context. Just wait for a minute or so. Any questions that I can respond to. Thanks again for the feedback. Very encouraging. And sometimes I feel quite alone doing this of research and work because it is pioneering in some way. Lois is asking if I have a website. My work at the moment is situated within an organization called Sanctuary Mental Health Ministries, where we're working particularly within the Christian tradition at the moment. And we are working with communities to help them understand the recovery process within their tradition. We are also building a website, an interfaith website, and I'm working with an interfaith collaboration that's funded by Vancouver Foundation to have portals for individuals who come from different perspectives to find resources that are accessible for their particular spiritual language. And that resource should be available by the end of the year. And I certainly will keep Dr. Regina Casey in the loop about the developments, and hopefully that can then be posted as well. Thank you, Giovanna, for that comment. We certainly are doing our best to have representation. At this stage, we are working on the top 7 demographic, statistically represented in the Greater Vancouver area. And I'm not sure that the pagan spirituality is within those within that population that we've been given a mandate to provide for. But I will certainly keep that in mind and hold a space so that when we get more money and resource to continue development of that website, that there is definitely space for the pagan voice, which I think is a really necessary one, particularly in the West Coast. And perhaps I could connect with Giovanna, with you, if there's a way that we can connect. I would love to have your input into that. That would be. It is nearing 5 minutes past 12. I wonder if we can wrap that up. Thank you so much, Matthew, for hosting our time. I have thoroughly would have loved to have seen you all face to face, but it has been wonderful to get the feedback from you in writing.
Absolutely. Thank you so much, Sharon. It was an absolute pleasure having you present for us. Your knowledge and your wisdom is invaluable, and we will carry on with the work, and we will hold on to the learning that we've done today and make it available for other folks. So participants today can share the presentation through the video and through the website, and if there's any follow-up information from Dr. Smith, then we'll be able to bring it to folks via the website as well. So perhaps if folks were interested in getting in touch, Giovanna, if you wanted to send me an email through the website, we can connect that way. And otherwise, everybody, we hope you have a wonderful day. Just a reminder that the next session is on May 8th, and it will be profiling wellness recovery action plans and wellness self-management techniques. And you can register for it at the website. All right, thank you, everyone. Have a wonderful day.